We are the Biomech builders. We are Emma Donatelli, Leah Faru, Akash Katakota, Jen Mahexko, and Jace Statham. Our clinical mentor was Dr. Jonathan Hughes.
Warning, what you are about to see is graphic in nature. During shoulder arthroplasty or shoulder replacement surgery, current retractors pose significant challenges when manipulating the glenoid, the socket of the shoulder joint. Surgeons rely on retractors to isolate the glenoid by placing the tines around the bone to open the area for optimal visibility during surgery. Current retractors are designed with a one-size-fits-all approach without the option of customization. This fails to account for the unique anatomy of patients. During shoulder arthroplasty, it is common for the retractors to slip or shift, risking damage to surrounding tissues and nerves. This lack of customization in retractors makes it difficult to achieve proper positioning for exposure of the joint during surgery. This lack of exposure can lead to longer surgical times, increased fatigue, and could potentially compromise the overall success of the surgery.
Our first prototype was just a simple styrofoam handle with removable dowels to show the changing of the blades and the different size construction paper to show the different angles. It also had a flashlight.
So our second prototype deals with a retractor that can attach to drapes so that we don't have another person in the OR surrounding the patient, holding the retractor in place throughout the entire procedure, which will also eliminate the fatigue of that individual as well. So how it is set up in the OR for these types of procedures. And we mimicked this whenever we were doing our prototype testing through creating a mock drape that our device is attached to, as seen in the picture. And in the video, we show it pushing away the fabric, which is simulating skin or muscle, and being able to attach onto the bone.
So our testing plan is to show our mentor our prototypes and collect feedback on the must-haves and nice-to-haves. The next step is to improve the design based on that feedback. And then the last step is to repeat this iterative loop of improving the design and getting feedback. So we are currently on improving the design based on the feedback we received from our mentor in the meeting that we had last week. So some results we got from this meeting with our mentor were that we want to avoid curvature at the bottom of the retractor handle, as this just adds excess material and can get caught on things in the surgical suite. The retractor should have a simple button for insertion and removal for ease of use. The handle needs to be made of something that is cheap and sterilizable. And we want to create the blades from anatomical models printed from the CT scans that each patient gets before these surgical operations.
We were able to meet with our mentor, Dr. Hughes, on October 14th to test our initial prototype of the retractor. This is one of the videos we took of our mentor testing our prototype. During this testing, he liked the overall idea of the interchangeable blade for the retractor, but had some concerns about the bulkiness of the handle, as well as ensuring that the blade of the retractor was made of a metal that was sterilizable and pliable to allow flexibility around different types of openings. Along with this, he also suggested a way to hook the retractor onto the bed to eliminate the need for alternate personnel, as well as teeth on the end of the retractor to better grip onto bone. We took all these ideas into account when we went to work on our second revision of the prototype.